Well, here we are discussing the COVID-19 pandemic, and it's all about the Ghana Health Service giving booster shots. We're going to be having an interaction on that. We're also going to be talking about pregnant women who are now eligible for the shots. Our guests, Dr. Yao Bediako, immunologist at WACBIP of the University of Ghana, and Dr. Fred Adomako-Boateng, Bono East Director of Health. Gentlemen, a very good morning to you.
Good morning.
Do we have both of you? Do I hear Dr. Yabediako? Okay, so I have Dr. Fred Adomako-Boateng then.
Good morning.
Right, good morning to you. Thank you for joining the conversation. The last time we had an interaction, Dr. Adomako-Boateng, you spoke of the fact that of course, your region had not met its targets and you were still continuing in terms of the drive to meet certain numbers. What has changed so far? What are the gains that you can share with us this morning as far as the vaccination drive in the Bono East is concerned?
Okay. So we are not doing bad. I mean, if we listen to the Director General's and the Minister of Health,
the presser
meeting the press yesterday, I think you saw the figures, kind of. We are not doing bad if you look at the figures in the country. But then you see that following the population census,
right,
our figures have been updated. Initially, the total population was around 920, almost 1 million. With the census now, the population of Bono East is now 1,221,000.
Right.
So people who are now eligible for the vaccines are 774,000. You remember initially it used to be 730,000.
Right.
So based on this and with changing the figures, now the people who have gotten at least one dose, the population 34.8, almost 35%.
Right.
And those who are fully vaccinated for Bono is 15%. So this is where we stand now. If we had not actually updated the figures, we will be clocking around 40% or 42%. But we are still going to step up the drive and to make sure that people who are really eligible for the vaccines will really get it. Because if you see the figures coming up with admissions, with death, we think that if you have the vaccines, you are really protected. So this is the drive that we are going to embark on.
Thanks for that update. Let's segue into that especially because the Director General of the Ghana Health Service, Dr. Patrick Kumar-Boaje, was speaking yesterday, like you rightly said. Let's take some snippets from what they had to say at that confab with the press.
Booster will be offered to all health workers. Will be given booster. And the booster is 3 to 6 months after your last vaccination. Which means that if you had your last dose, say in March, you'll be eligible for a booster dose between 3 to 6 months. Not immediately you've had that. And so that will affect all health workers, persons with underlying medical conditions such as diabetes, hypertension, persons 60 years and above, frontline security personnel, and members of the executive, judiciary, and legislature. It actually mirrors the initial prioritization that was done. Pregnant women who are unvaccinated will now be offered, can now be vaccinated. Previously, it was not policy to vaccinate them. Now they can be vaccinated. And they are recommending that we use either Moderna or Pfizer, which is the mRNA technology, to vaccinate them.
All right, so this is the real state of affairs when it comes to our vaccination drive. Let me interact now with Dr. Yabediako, who joins us via phone. Looking at the projections we had, let's say last year, for the tail end of last year, where we were expecting to vaccinate some 20 million people, and where we find ourselves currently having gone through this latest wave of Omicron fears and all of that. How would you assess how far we have come so far in a nutshell?
Thank you, Benjamin. Well, I think we can pat ourselves on the back a little bit for staying the course. But as the numbers would suggest, if only 15% are fully vaccinated, the goal is 70%. So we still have considerable way to go. So I think we have to continue. The challenge is now that number of fully vaccinated. Now with the inclusion of boosters, it almost resets your clock. And this was the fear we had, that if we did not vaccinate quick enough, we would have to start revaccinating people who are already vaccinated. And that is in effect what the booster is. There's a realization that about 6 months after your last dose, the efficacy of the vaccine wanes considerably. And so there is a need to administer boosters. That is what's happening in Europe and North America and other parts of the world. So as much as it is great that we have managed to so far fully vaccinate 15%, we are trying to hit 70%. But the longer it takes us, the more we have to administer boosters. So, if you understand what I mean, we have to really accelerate the process of vaccinating so that everybody at least gets their first 2 doses. But then we have to bear in mind that we are also now in the era of having to give boosters. So that means that till people have received their booster, they are no longer as protected as they were. And so we are going to have to just keep vaccinating.
Let's talk about vaccines for pregnant women. And now we're saying we're giving the green light for them to also start getting vaccinated. What are the pros and cons, scientifically speaking? The rest of the world, some of them have already initiated this course. Initially, it wasn't really known because this is a new strain of COVID, whether it was safe to vaccinate pregnant women. We're now going to embark on that journey. What are the things we should be considering?
Oh, every pregnant woman should get vaccinated. It's as simple as that. In some ways, we are a little bit slow to respond. The reason you typically wait is to, with any new medical intervention, typically pregnant women are we are the most cautious with pregnant women because we need to assess the potential effect on the woman or on her developing baby. But evidence has been out for a while that there's no danger posed to either. And many countries have been vaccinating pregnant women for quite a while. So there's no, I think that the scientific data is quite clear. There is really no reason why a pregnant woman should not be vaccinated, especially because pregnant women are actually particularly susceptible to the more severe consequences of COVID.
Right.
So they're already a more susceptible group. And so now that the scientific data is clear that there is no danger posed, then they should be moved to the front of the line because they are a high-risk group for severe COVID complications.
And it's important you make that initial point that pregnant women are very susceptible when it comes to COVID and getting severe forms of COVID. And something else that scientifically we also know is that there is no proof, no evidence to the effect that maybe they will suffer any fertility issues. That has also been scientifically proven. So I guess the mandate then is to go and get vaccinated. Let me come to you, Dr. Adomako Boateng then. So now that you've got the green light as far as pregnant women are concerned as well, what is the plan in the Bono East region? How are you going to roll this out targeting pregnant women? What's the plan?
So we are going to engage them, social mobilization. We are going to intensify education, especially at our antenatal care centers, where we will engage them. And I think if we listen to Director General, the effect on COVID on pregnant women was severe. I mean, we realized initially we thought that it will have effect on the unborn baby and the mother. But we saw that the repercussions of them not receiving the vaccines were more severe than they receiving, and especially looking at the data around, we see that it doesn't actually have any effect on the baby. So we are going to engage the pregnant women. We are going to engage the traditional authorities and other opinion leaders for them to know the new policy and then also start administering. It's because of all these that the eligible population has actually increased, because initially you remember that they were not factored into the eligibility criteria. But now as they have been included, we have to use all the available methods that we have been using, especially the ANC, engaging them and then letting them know the benefits for receiving it. And we will start just from today going, and we make sure that our numbers will increase.
So do you have any idea what the numbers look like? I mean, do you have an idea from your health directorate? I'm sure you know, for example, if they've been coming for antenatal care and all of that, you know how many people, at least you have an idea how many people you're targeting in that bracket.
We are really looking at up to 20 to 30,000 pregnant women to be given the vaccine.
Mm. Let me come back to you, Dr. Yao-Bediako, and it has to do with the issue of boosters. I've discussed this with Dr. Sapong Esiedu, among others, and it's interesting because across the world there are different pieces of research, and the European Union, they are talking about the fact that yes, get boosters, maybe, so you've got your 2 shots, maybe a booster shot, maybe one final booster shot. But they are saying the more you take these boosters, the more you also affect your general immunity to different diseases. There are those like Dr. Sapong Esiedu, research fellow with the CDD, who also says that no, it's not really a problem, because if you look at the flu, when you go to the UK, people have been practically taking it all their lives, every year. As a country, where do you feel we should strike the balance? Because it also has a cost component. What is your take on that, Dr. Bediako?
Well, first of all, I agree with Pramit that there is really, I don't really buy this idea that constant boosting has any real effect on your immune system. Our immune systems are always responding to challenge. That's what our immune systems do. When you walk outside, when a mosquito bites you, when you get a cold, those are all immune challenges. If our immune system got tired as a result of being exposed, we'd all have serious issues. So I really, from an immunological perspective, which is my particular area of expertise, I really don't see much. I don't give much weight to these concerns or these stories about exhausting your immune system as a result of constant immunization or boosting. But obviously, yes, there is a cost implication when it comes to the government procuring vaccines and continuing to vaccinate. Once again, the only way to get around that is to try to vaccinate as many people as quickly as possible, so that we can lower the incidence of the virus among our population sufficiently that it is less of a concern. If we continue to dribble out vaccines, if people continue not to necessarily show up to get vaccinated, if we remain below 60 or 70% vaccination, then the likelihood that we need to continue boosting it grows, because, as I said before, you require a booster because after about 6 to 7 months, your level of your titer of antibodies drops, and so you are more susceptible, you are more likely to get reinfected. But if enough people have been vaccinated, then there's enough protection, there's herd immunity, as everybody. Up until we control the spread of the virus, or there's sufficient immunity in the community, we may be faced with the prospect of requiring boosters from time to time. As he said, with flu, every year you get a flu shot because the flu virus changes. The WHO makes a recommendation, and in countries in sort of the northern hemisphere, they recommend flu shots every year. Now, whether COVID-19 becomes something like that, where the SARS-CoV-2 virus, every year they recommend people getting some sort of boost. Those of infections drop sufficiently that we probably don't require boosters. We don't require boosters.
Dr. Boateng, I don't know, even before this announcement was made, had there ever been any discussions about booster shots in your region? And if so, how did people react, especially those who had already got 1 or 2 shots? How have people, if you've run it by them, reacted to getting extra shots moving forward, especially as we've been told that we could be dealing with COVID-19 for many years to come.
So I agree, but I think we are still in the learning mode, and I believe that even as the pandemic unfolds and maybe it becomes endemic and seasonal, the people who are going to get boosters are going to be different. And if we listen to Director General and the Minister's policy, we are looking at people who are at a higher risk of getting the COVID, and not really even when they have the COVID, the severity or the mortality, morbidity associated, but the other effects like security officers, health workers not coming to work, and therefore affecting a lot of productivity. So you look at it in context of what you want to achieve. And going forward, I think as we begin to look at the data, we will see those who are particularly affected, those who are not, and therefore those who will need the booster. So it's not going to be a general thing that everybody should be getting the booster. And I think as the pandemic also unfolds, we will see the presentation in this part of the world as compared to the others. And that one will inform us with the booster. And I can tell you that with the Omicron, what actually hit us most was the isolation period where people were, health staff affected, were supposed to be isolated for 14 days because they have it. And then when also those who were exposed, and then they were supposed to go into quarantine for at least the incubation period. And taking this into consideration, you see the effect on COVID on us. Therefore, the need for the booster for health workers. So going forward, we are going to still look at the impact of booster. But we have a challenge, especially when people are supposed to take the second dose. You see that we are lagging. We will still have to put in mechanisms to get people vaccinated. I have staff, about more than 80% got the first dose. But currently, as we are speaking, we have not been able to even achieve almost that number for the second dose and for to be fully vaccinated. So these are the challenges that we will have to look at. It has to become mandatory, especially those who are going to be in direct contact with patients, and therefore the likelihood of them exposing the patient to the risk, or they also being exposed to the disease. So we have to look at it and then segment them as we go forward. But then we have to look at our data critically so that we are fluid and we'll be able to make the changes as and when. As booster actually is needed for our health workers, especially those in direct contact with patients, and then the other health security agencies. Thank you.
Dr. Bediako, going back to the issue of costs, so apart from singling out those who may necessarily need the boosters, of course, not everyone would need it unless there is some severe outbreak in the country. How do we scale back on cost? How do we not feed into the hands of what some have called big tech or the pharmaceutical giants? And it's interesting. I'm just looking here at a shot of one of these foreign papers, and it takes a look at how 3 new billionaires have been minted. I'm talking about Moderna, and how their co-founders, Robert Langer and Nubar Afian, together with an early investor, Timothy Springer, status. 3.5 billion for Robert Langer, 3.7 billion for Nubar, and 4.4 billion for Timothy Springer. As a country in the financial situation we find ourselves, how do we avert this? What are some of the smart processes we should be adopting?
Well, I mean, I think, first of all, it's also important that we don't buy into this. I also think it's an anti-vax sort of myth that somehow there's some great conspiracy by big pharma. Yes, people have made money, but people make money in business all the time. I mean, that is the nature of business. These companies saw the opportunity, invested heavily in trying to create a vaccine, and I don't think we should begrudge them for making the return.
I'm not suggesting that we should begrudge them, but how can we ensure that whatever we are putting out there in terms of resources that we have very little of, it doesn't become some albatross around our neck, basically?
Well, and that is what I've been saying, that our approach has to be vaccinate as many people as quickly as we can, so that we hopefully require there's less need for boosting. From the very, very beginning of this pandemic, scientists like myself have been saying, the longer we take to vaccinate people, the more likely we are to still deal with this virus over a period of time, because the virus keeps mutating, and if we don't vaccinate quickly, over time, the vaccines that we have lose their efficacy and we need to do more. We have to find new vaccines, or we have to vaccinate again with what we have. So I think in terms of trying to avoid it becoming a financial burden, first of all, a large amount of the vaccines that we are using in this country are donated. The government has purchased some, but the vast majority of vaccines distributed in Ghana have been through the COVAX facility, for which Ghana has paid us. So for now, I don't really think that the vaccination drive in Ghana is costing Ghana a lot. I suspect the country spends a lot more money on many other things besides the COVID vaccination drive. So we should be thankful for that, at least, that majority of the vaccines that currently are in circulation have been donated by other countries, or by the COVAX facility, or by the African Union and other entities. So for now, I don't think the consideration should be how do we save money. We ultimately will help our economy and save money in the long run by getting everybody vaccinated, so that the economic effects of COVID-19 are reduced. When the doctor was talking about people not showing up for work and the burden that places, once everybody is vaccinated, and hopefully vaccinated enough to, like I said, drive down infection rates, then we will see greater productivity in our economy. So for now, billions of dollars that advanced countries have had, but that is also the reason why we are way behind. Certain countries have vaccinated 90% of their population, and we are looking around 15%, partly because we've had to depend on the philanthropy and the goodwill of other countries. But that also means that at this point, it's not like we've spent a huge amount of money, or continue to spend a huge amount of money, because we're getting these vaccines for free. So I think we should keep that in mind. But of course, if we have the right vaccination strategy, and people in Ghana cooperate with the Ghana Health Service and avail themselves of vaccination, my hope is that we will drive sufficient immunity that there will be less need for boosting. But if we continue to be slow about it, and continue to be hesitant, and listen to certain conspiracies that sort of affect our ability to show up to get vaccinated, then potentially we'll be dealing with this for a long time.
Right. Just a quick follow-up issue. So we now know that, and this is news that has been hitting us very recently, that South Africa is now going to be producing these vaccines, the entire process of creating these or making these COVID-19 vaccines from start to finish. How much of a boost is that for vaccine production on the continent and dealing with COVID-19? They have said that we've had the short end of the stick, we've been at the tail always when it comes to receiving vaccines. How much of a boost do you feel this is, Dr. Bediako, for the African continent in dealing with COVID-19?
Oh, it's a significant boost. It's not just for COVID-19, but for vaccine production in general. I mean, we use vaccines for many things. We did not just start vaccinating people with COVID-19. All of us around, whether we've had a COVID vaccine or not, have been vaccinated for something. So the idea that this pandemic has spurred the development of vaccine capacity on the continent is very positive. I believe there are discussions about local production even in Ghana. So I know that His Excellency the President has convened a committee to look into this. So hopefully to not just be South Africa that is producing vaccines, Ghana will get in on that as well. And I think these are important developments. We need to recognize that we need to be more self-sufficient. We need to invest in our health research infrastructure and invest in the long term in these areas, even though they may be long-term investments. You don't see the returns. When you invest in research and health, you don't see the returns overnight. But when something like COVID strikes, that's when you see the results. So a lot of us are hoping that this is not just in South Africa, but in many other countries like Ghana, we will step up. We will find ways to find the resources to invest in some of these capacities so that we are not completely at the mercy of overseas powers or other countries when situations like this arise. And certainly, hopefully, by manufacturing on the continent, the cost of vaccines and the availability of vaccines will improve.
Okay. Dr. Boateng, what are your expectations on the back of South Africa taking the lead when it comes to COVID-19 vaccine production on the continent? What are you looking forward to?
A lot of lessons that the country should learn from this pandemic, from PPEs to vaccines. You recall that at the beginning of the pandemic, we had challenges even with personal protective equipment. Not only Ghana, even the Western countries. Remember when China decided that they are no more going to export some of these PPE, and what happened? And you know, currently as we are speaking, China is not importing any vaccines. Russia is not importing any vaccine, Sputnik. So what do we do as a country? What lesson do we learn? Can we position ourselves in such a way that we can also produce and also export and make billionaires out of the country? These are things that I think we should be looking at. The lessons that we have learned in terms of PPE. Can we now produce N95? Can we produce surgical masks? Do we have capacity to produce gloves so that when it hits us hard, we will not be at the mercy of other countries?
In other words, Dr. Bediako, pardon the interjection. We've said so many things in the past, and we'll do this and we'll do that. We even spoke about setting up an immunization, through on the very things we've said we will be doing. Dr. Boateng, are you there?
Yeah,
right.
I'm here. So that's I can't. So these are the things that I think as a nation we should be discussing, because this is not going to be the end. So what have we learned? And not only that, we also learned that we needed more expertise in terms of emergency care. These are lessons that I think we have to plan in the long term how we are going to address it. So that if people are also going to make money out of this, what prevents us from also making money? I mean, it's knowledge and technology. What prevents us from coming together as a continent, as a sub-region, as academicians? I mean, these are things that I think we will have to be discussing. How are we using our data to inform decision in country so that we are not going to, you remember today, South Africa were complaining when they came out and they were able to discover Omicron and the response of the world. And when they even came and told the world that, look, Omicron is milder in terms of severity, and just that the transmissibility is so high. And I think the world did not take them serious, but they have been vindicated. So how do we position ourselves? These are questions that I have been asking myself, and we need to ask going forward. How do we address these issues?
Right.
We have to be thinking about these.
I'd like to wrap the conversation with you, hopefully on the subject of a vaccine mandate. It's interesting because I listened to the BBC yesterday, and in other countries, in Greece, in France, there are stiffer measures required. Some would require that you have PCR testing before you can even go for a cup of coffee at your local cafe. Before you can even see your cobbler, you are restricted to maybe the pharmacy and the supermarket, and that is it. In Greece and some places, you would have to pay certain fines up to about 50 euros a month just because you've not taken a vaccine. What do you think, Dr. Bediako, we should be doing in terms of enforcing our own version of a vaccine mandate? Should we go to such extremes as some people are going through in other parts of the world?
Well, I am personally in support of vaccine mandates, but I think you have to do them. You have to be sensitive to the fact of the availability of vaccines. So I think, and I think what Ghana has tried to do is to gradually phase in certain mandates as more and more vaccines have become available. You cannot punish people for not getting vaccinated when you don't have the vaccines available. But now that we have vaccines available, I think some level of measures are required. I mean, this is a serious, you have to step in. and create certain choices. No one is forcing anyone to get vaccinated, but if you choose not to get vaccinated, then there are going to be certain consequences. Because this is not about an individual's health, it is about the health of the nation. And for protecting other people who, like for instance, children who may not yet be getting vaccinated. So I think that we have to think about the mandates. Obviously, you have to put mandates in place that are going to be the most helpful. The point of a mandate is not to punish anyone; it is to try to encourage people to adhere to a guideline. So I think we have to think carefully about what kinds of mandates we enforce. But I think we do need some level of mandates. And the most important thing is if you declare those mandates, then we have to enforce them.
Sorry, could you say that again?
There's no point having a mandate that is not enforced. So I think it has to be thought through. But once we decide what the mandates are, then they should be enforced to the letter of the law to demonstrate that the government is serious about this, and that will drive compliance and adherence.
If very briefly, in maybe some 15, 20 seconds, if you could propose one thing that if we wanted to go that...
a vaccine certificate, I think is a fair one. A number of countries have done that. That if you want to access government services, whether it's getting a driver's license or showing up at somewhere to pay your taxes, whatever it might be, where it's going to put you in contact with a large number of people, before you enter the facility, you should show your vaccination card. I think that is justifiable. I think that is something that has been proven to work elsewhere. And it's certainly something that Ghana probably should implement. Okay, so your final comments, Dr. Boateng, on the same beat, and it has to do with a vaccine mandate. And in Greece, for example, they will tell you that you're creating a health risk, which could lead to a health burden, which could be costs to the state. So you have to pay for it. What would you propose in that respect in terms of mandatory vaccination in Ghana? And those will be your final comments, Dr. Boateng.
Thank you. I think it's needful. I mean, if you look at our data, you remember at the beginning, the way our health workers suffered. So if for nothing, I think health workers will need vaccines. And I remember the security officers were also saying that they were also frontliners. So everybody who is going to kind of put somebody at risk, you actually need the vaccines. How do we go around it? And I think that's what Dr. Mediako has said. In Bunu, we have put in some mechanism like if you are not vaccinated, you can't go for conferences. And I think it's one of the most important activities that we are supposed to do to upgrade or to register your licenses. So we are finding innovative ways of making sure that people actually are vaccinated.
Okay.
And we also state that if you are coming to a hospital or a health facility, you have to show proof of vaccination. There are a lot of innovative ways that I think we can go. But let's look at our data and see those which are really needed. But one thing I would say is that if we cannot enforce any mandate or rule, please, let's look at it and then see how we can address it before we really give mandates. You remember the mask, a lot of people flouted it because we could not really enforce. So let's see ways that we can enforce, and then if we can graduate it from one step to another. That's also important. Thank you.
Well, gentlemen, it's always refreshing catching up with you and sharing thoughts. We're still dealing with COVID-19, but we're grateful that you've shared your thoughts with us. Dr. Yabediako is an immunologist with WACBIP at the University of Ghana. Dr. Fred Adomako Boateng is the Bono East Director of Health. Thank you so much for joining the conversation. And this is where we draw the curtains on today's installment of the AM show. My name is Benjamin Akapo. Thank you for joining. Let's do Friday tomorrow from 6 to 9 a.m. Have a good day.